Hi, welcome to Voices of Somerville. I'm Sonia Durai, and we bring this show to you every month to talk about the different voices in Somerville. And thanks for joining us. I'm from the Office of Somerville Commissions, and this is part of the City of Somerville. And we do services that reach out to the community around vulnerable community members, marginalized members, as well as run the commissions for human rights, women, multicultural affairs, and we house the LGBT liaison. So sit back and enjoy today's show. I'm glad to say we have Wayside here to talk about HIV and AIDS prevention, as well as alcohol and drug abuse support. And today we have Suzanne Boucher and Jenny Khweiss, and we're going to talk about all the programming that you have in your community available. So sit back and enjoy the show. Hello, Suzanne.
Hello, how are you?
I want to give you a first chance to talk a little bit about the programming that you do, and then we'll bring in Jenny and talk a little bit more. So tell me a little bit about Wayside.
Well, Wayside, it's very interesting because it was started by some concerned parents about 27 years ago in the community. It started in Framingham, just as a one small house for runaway and homeless kids. And it now has probably 1,000 employees and many thousand clients. And we have programs in Framingham, Watertown, Milford, Medford, Somerville, Cambridge. We're all over the place. And I love the fact that it was started by our CEO and president, Eric Massey, and a group of his friends, parents, who were worried about the kids in the community. So I'm proud of that. I'm proud to be affiliated with that.
Right. The power of family and community is what is bringing Wayside in to so many places. So that's wonderful.
It's really all about community. And our program, today we're going to talk about our Young Adult Action Project, which we call YAP. I tried to make the most annoying acronym I could.
Yeah, good for
I think
you.
I did
That
a good job.
that was a good one,
that
although
was a good one.
We might have a competition with some other ones, but that's a fantastic start.
Yes, and when we talk about it, we're going to also talk about, speaking of community, what we use is a participatory action research method, which is the community is the expert. The people in the community know what the community needs. We don't know. We go in there and find the leaders in the community and help them progress as leaders.
I think that's, I really do like the participatory. I'm familiar with it from the rural overseas strategies, and it was very powerful, really puts all of the information and the value of the known data that every neighbor knew and puts it into something very powerful. So, and I really appreciate that. So that's wonderful.
Yes, we love it. We're very much of a strength-based agency, and the strength of the client, the strength of the participant, strength of the person that we're working with in the community.
I think that fits really well with Somerville, so we're glad
does.
to have it. Yeah.
Yeah, Somerville's
really
a very
good
proactive place to be. I'm also a resident of Somerville.
Oh, very good.
Which is why I write the grants to bring programs into Somerville.
Right, which is fun, fantastic. So Jenny, tell me a little bit about some of the work that you've been also bringing into Wayside.
Well, I've been with Wayside for 15 years, and most of the program that we've been working with is about family altogether. It's like youth and family. And what Suzanne talked about, the participatory action research project, is like you bring the service to the community to where they at. No, like they have to come and search for us, because I think some of them, they have stuff like, we cannot go to you. They have some blocks to come to you, school, parents working, parenting. So we give them the what we have and bring it to them. The latest program that we've been working with is for young adult 18 to 24, and it's about HIV, AIDS, and substance abuse, and it's for those homeless, more like in risk of not losing their houses. And we go to the shelters, resident places where they are. We go to schools. We go to community where they serve those young adults because some of them, they don't have that kind of program. So it's more about to facilitate, educate, and train each other as we go.
That's wonderful. And I know that it's just a developing program that we're all getting to start learn about, so it's really good to hear. And you've been in all of the community meetings and facilitating more, so that's really wonderful.
Yes.
So tell me a little bit more about like what are some of the goals that you're wanting to do. We're starting a new school year, so do you have some particular goals that you're trying to reach out to?
Well, yes, we have 4 main goals. We try to go by the federal policies that Health and Human Services are pushing right now. So they're very interested in having a public health approach. So for us, our public health approach is our condom distribution, which we have distributed, I think about 30,000 condoms now in Somerville at the barber shops and hair salons and nail salons in Somerville in the last 4 years.
And I think that you also have like right on the condom information about HIV-free testing. So it's not only a great resource for people to just grab a pocketful, but that it has
The phone number
number right away telling people, go for this,
For instance,
get free testing.
if you grab a handful of these and you have sex, and what if that condom broke? Well, you can just pick up this thing and say, that's the phone number. I'm going to call that phone number and get a
Right
test
away.
right
Right.
away. Yeah. So so that's the public health side. We also have the behavioral health side, which is the Street Smart program. And I really want Jenny to talk about Street Smart because she is a trainer for Street Smart, and she's boots on the ground for Street Smart. So.
Very good.
So yeah, Street Smart is one of the curriculum that we use, and it's in an interactive. It's another kind of concept of curriculum that is not that you are the facilitator and you talk everything, thinking that we know everything. It's more about them talking and they being the experts. So if we have a question about what is HIV, we don't say what is HIV, we just bring it to them. So they just, kind of whisper it to each other or brainstorm. And those are 8 course sessions. And what I mean by 8 course session is like very educational about what specific is HIV and what is substance abuse and how we can deal in some places with that and get more educated on it. And the 9th session is about one-on-one. It's like what is the program about, what you took from the program. And if they need any kind of help, we can help them because also Wayside has a lot of expertise. We're not experienced in some areas, so we have the people who can support them when they need it. And also the 10th session is bringing some of the resources that you have in your own community for them to go. In this case, we have, like you say before over here, in the condom they have Cambridge Health Alliance. And Cambridge Health Alliance is the one who is a partner with Wayside in this grant. And they come and they talk to the participants. They answer any question that they have. And they also tell them what the resources are in their facilities. And the counseling and testing is also very much, you don't want to talk about it in front of everybody, so it's confidential for them and it's free. And for those of many people who doesn't know, here in Massachusetts, the law for testing an HIV is 13 years old, and you don't need your parents' permission to do so. So all of those resources are free for the participant or anybody who is going to Cambridge Health Alliance. So, and they get, at the end of the program, they also get a certificate of completion of the program. And by that completion of the program, they can also become peer educators for the next session that we will have in any other places. They can be educating peer-to-peer to others and sending that message, what they get in the first one that they have. And of course, they become like a staff, and they get paid for it. And in the curriculum, the Straight Smart is also connected. Brandeis University is the person who administered the surveys for us, and they get $20 for the first survey, $20 for the second survey, which is at the end of the program, and 3 months after they get $20 more. So the reason for the first survey is like how much they know before we start the program, the baseline. The second survey is how much you're getting from that program. And the third one is like, are you retaining? Where do you get in it to? Are you sending information to other people, to your community? And then in between those are interim survey, and see how the facilitators are doing and how much more they get in. And they also get rewarded for $15 gift cards. And it's all fun, it's food involved, it's very interactive, everybody have fun.
That's
so
great.
I recommend it for everybody.
Yeah, exactly.
Yeah.
And who are some of the local partners? Do you recruit your own groups, or do you partner with the local Somerville agencies?
As a matter of fact, we have a stakeholder meeting, the community working group, the YARP community working group that is coming at the Somerville Police Department, and it's going to be Monday, the 27th of this month, October, from 9 to 11-ish. And the Somerville Police Department is one of our partners also. And we have many partners who work in the same prevention area. And you can say more about it, Suzanne.
Well, the police are a great partner. Our hospital partner, Cambridge Health Alliance, is very important to us. We've had 3 grants in a row that we're partnering with Cambridge Health Alliance, and we were able to bring rapid testing to Somerville through our first grant 9 years ago, I think it was, and we proposed at that time to do maybe 100 rapid tests. Well, we've done 4,000 rapid tests just in one grant.
Wow.
And we had
Just for
2
Somerville?
In Somerville.
Yes.
Well,
yeah. In
That's
Cambridge Health
fantastic.
Alliance.
People are really using it.
Yes.
So it's not something that
No.
just a couple people are going to go do. It's like, this is a community thing.
Huge.
The people are doing it.
Yes, and the other thing is we've seen a lot of rise in people doing multiple tests. So if there's like I was talking about, say the condom broke, you got the phone number. So if something happens and you're exposed and you don't know if your partner is clean, if your partner is not infected, you go and get it tested again. So we're seeing a rise in people going multiple times to get tested, which is great news. And the best news is that we have seen transmission rates in Somerville go down over the period of the grant. I'm not claiming that we did that, but hey, we didn't hurt.
Right, right. And how would we like encourage more access to different partners? You have your community partnership coming up. That's
Yes.
For people who want to participate in that way.
Yes.
There's ways for organizations to
Yes.
sign up.
Yes.
Individuals have so many different ways to participate in the YAP program.
Yes, and they can contact Jenny or myself. Jenny's the program supervisor, and she's very much of the day-to-day supervision of the grant, and I think that we're going to put up some information on the screen later about how to get in touch with us. we're at the Watertown office of Wayside, and you can always find us there. But the community partners range from the churches, the youth groups, all the youth-serving agencies, the schools, Scale. We have Bunker Hill Community College. We're now partnering with UMass Boston. We have a very far-reaching partnership. The Haitian Coalition has been a very strong partner with us for about 10 years. They've been a strong partner.
We also have
Welcome Project.
Welcome Project. We have Mystic Learning Center. We've been working with, I should say, Mystic Civic Center, or
It's a learning center.
it's a learning center.
Yeah.
And we've been working with them for about 15 years,
About 15 years,
since we started, and it's a great. The other one that we working with is who works there? In your Somerville Commission department?
Oh, in the Women's Commission?
The
LGBTQ?
No,
Commission?
the person who, Nancy Bacci.
Oh, with the youth. Nancy's
Yes.
with youth.
What is
Yeah.
Nancy
So
Bacci?
Nancy Bacci, she's the Director of Human Services for the Health
And
Department.
also the executive
Oh,
director, Corey Mashburn.
SCAP.
Yes.
Yeah.
SCAP?
And that's the Somerville Cares About Prevention.
Yes.
Right.
So we work together,
Yes.
and they usually when we have the community working group, they have opportunities to bring also update us and what they have been working with, and most of the time it's the data information and the risk behavior survey.
Yes, the
Also
youth
that
risk
they do the
behavior
youth
survey
risk.
that we do annually.
Yes.
Yes, we do that with the 6th through 8th graders
Yes.
every other year,
Middle
and then
school and
9
high
to
school.
12th.
Yes.
It's fantastic data.
Yeah.
And we've it's written into the proposals that we try to data share with, especially with SCAP, with the city of Somerville, but because we've been collecting this data now for on the Somerville area for 10 years, 11 years now, and we have a lot of data. So we're trying to work out a data sharing process that we're still working on, but it's coming along, and so I think that's important, not to just keep our information private, like these are our findings, you can't have them. No, that's not how we work.
Oh, good. Yeah,
We
'cause I
do
know
this-
the SCAP has a big public event to share their data. So
Yes, and we do the same thing with grant writing. Like if you were to come to our meeting, you would see me stand up and say, okay, sustainability, how are we going to keep this going? After this grant ends, we want to write grants with you. And so we have partnered with Cambridge Health Alliance, we've partnered with the Haitian Coalition, we've talked with BARC about writing grants together with them, and multiple people, Welcome Project. So we're always looking to partner on grant writing. So, we could do a smaller part of the piece, or we could do a bigger part of the piece. But community is what it's all
And
about.
I'm glad that you brought the sustainability, because this is what we're going to talk about it. So everything that we do is like a transparent to the community. We invited even the youth to the stakeholders or community work, and they invested and they talk about the program, and also about sustainability and data, what we've been doing, how it is, and the part of sustainability says, okay, so how are we going to be able to know if they're going to keep doing this in the community? So the way that we do it is bringing them as leader. So you support your own group, you recruit in your own community, and you become your leader yourself because they already have the information. Now you bring it to some of these people that you have, your peers.
right, that's a great model because
Yeah.
it's a great opportunity to practice one way to share information, and that makes you open to maybe learn some more information and share that. And so
Right.
it's a good skill for people to get going.
And also, what we have always thought and have been saying in all these meetings all these years is that supposing there is no more funding, okay, but what have we left behind? We've left behind all these young people who can now pick up the torch.
Right.
And if they're interested in working on HIV prevention or substance abuse prevention or both, they're ready to educate their peers. They're ready to go out and work, and it has been working.
Right.
We've had good success with that.
So tell me a little bit about just kind of some of the information around HIV and AIDS and substance abuse that makes all of this work so compelling. Like,
well, the highest incidence of HIV transmission is now in African American men, particularly men who do not identify as gay but may be having sex with men. And the biggest risk factor, of course, is unsafe sex, not using a condom. So that's the highest rising group right now, whereas that group had been going down, but it's coming up again. The next highest group of increased HIV transmission is African American women, because their husbands or boyfriends or partner may be not identifying as gay and not identifying as bisexual, may not be telling them, but they may be having sex with men. So these are the, of course I'm not generalizing to the entire population of African Americans, but it is this group in particular that has spiked.
So it's an opportunity to do more education to various folks, and it just helps to know who might be a good group to try to have those new bigger connections with.
Like in the early days, in the 80s of the AIDS crisis, the target population was almost exclusively white homosexual men, almost exclusively. And there was so much work done for the next 15, 20 years. They did so much work that that rate of transmission went way down. But that was in that community.
Right.
And it didn't generalize to the larger community and to communities of color. I really don't think it generalized. So now we have, this is what a lot of programs are working on right now.
Just to help to spread the news to other communities,
and
giving them the opportunity to know all the resources that are available, the rapid testing available, everything.
And to work against some of the stigmas and the myths. You know, in immigrant communities, there are often myths. They just need facts. They need the education. They need the facts, and the Street Smart program provides that. Really accurate facts.
Right. And then also, I know that your program also works on substance abuse as well. So what are the compelling data that you can share now?
Well, we know in our area, the Somerville and this surrounding area, we've had a lot of opioid-related deaths recently.
What kinds of opioids?
Well, it's more pills. Prescription drug abuse.
Pills, Is it
but
people who are getting
heroin.
their own prescriptions, or are they taking them from their parents or family
parents,
medicine
family,
cabinet?
or friends might be getting it from multiple places and selling it. There's multiple areas that they can be getting those from. But there's also the problem that heroin is very cheap.
Right.
And so it's a lot cheaper than OxyContin.
Right.
So that's a real problem right now.
And I think for some of the danger areas, and I'm asking, not saying, is if for people who may have had a gap in their drug abuse and you know, trying to recover, and then take an accidental overdose because they're getting back into. And so is that the heavier area where the big risk is when there's been a gap and then they start again, or is it switching, like, you know?
To me, the one, well, it depends on what age group you're talking about, but what I see, my practice, I'm also a licensed mental health counselor, and in my practice I see more young adults, and what I see is injuries and people getting prescribed as much, you know, Vicodin or codeine products or OxyContin, you know, almost an unlimited amount. It's very difficult, and there's a lot of work being done by the state to limit the prescribing. But a lot of what I see personally in my practice is injuries and people getting addicted through
through that.
having a back injury,
Right.
or something like that.
Right. I know when my husband had a very minor surgery, they prescribed, I totaled it out by how many pills there were. And if you totaled it all out, there was 150 hours of oxycodone
There you go.
medication. And the surgery was an extraordinarily minor.
Yes.
And
Yeah.
so it was shocking.
It's shocking.
And my husband could not even take the first pill. It just made him very ill.
Yeah.
And so he wasn't able
Good.
to even take it. And I was looking at this saying, oxycodone.
Right.
For that, it's like, I
Right.
think that, for most of the
Right.
things that I've had happen to me, they always just say, buck up, take your
Right.
ibuprofen.
And you bring up a very interesting point, too, because your husband wasn't able to take that medication. So where's that medication? So
Right.
this is one of the other big problems. It's sitting around in people's medicine cabinets or on their dresser or tucked away in a cupboard
Because you never
somewhere.
know. That's
'Cause
probably what
you
they
never
think.
know.
And it's like,
And
well,
it-
no, just get rid of it and go get
rid of
another
it.
prescription.
There
if
are
you need
lots and
something.
lots of drug take-back programs
Absolutely. Somerville.
in Somerville. I think CVS has had them, Walgreens has had them,
Yep,
the police
police
department
department.
has had them.
Yep.
So, we need to get that information out also.
Absolutely. So it's very easy to drop off that
Yes.
prescription. So
Yeah.
maybe
Don't
easy.
leave it out there, and don't flush it,
No.
because the fish are going to get real high.
Right. Well, it's also our drinking water.
Is-
So yes,
one-
Jenny.
One point that I want to make is it's really alarming when they get the pill they use in particular. If they cannot get those pills from doctor or whatever, they get it from the street and they pulverize them. They pharmacy them in their own house, and whatever they get, they do it and they do it together. They put like a sniffing them and all the stuff and selling out to anybody for I don't know how much money.
Right.
Another point is just to go back to HIV. People get confused with what is HIV and AIDS,
Yes.
and that's different.
Yes.
Because many times that we ask, what is HIV? People say you die from it.
Yes.
Well, HIV is the virus that you contact, and the AIDS is when you die. But
Right.
HIV you can live with treatment
Right.
for too many years. So
Right.
that needs to be
So finding out that if you have HIV is a
Getting tested.
powerful.
HIV positive.
It's an opportunity to find
Yes.
out what you can do next. It's not something to stay ignorant from. It's
Right.
it's best to prevent. Use your resources. So we're coming to the end of our conversation, and I'm just wondering what kind of last thoughts you'd like to leave the community, and what we hope to see in our community soon.
Come to our stakeholders meeting on October 27th at the police department, 9:30 in the morning, and we'd love to tell you lots more about it. And I just want to toot our own home once more that in this 4-year grant we've distributed 30,000 condoms, and we've done 4,000 rapid tests in the Somerville area. So
and also
Fantastic.
we're feeling proud.
Yeah.
the cards and the
Yeah.
MBT.
So yeah, we'll show the cards and make sure that we promote and
Look for
What
these
else?
in your
Also,
barber
don't
shop.
be afraid if you see this.
real close to your face.
Don't be afraid if you see this in the barber shops, nail salons.
Grab some.
In the areas of Somerville, they have like a dental dams with little, it's fruity, it's vanilla over
Flavored.
here. Flavors, it's many flavors and color. And you see that what is YAP and the whole information about us. I think it has the phone number. So just get educated. We here to help.
Right.
Come to us. We can help us. You can call anytime. We love the community. We love to help.
That's wonderful. And so we have an upcoming community event. We have the YAP program for learning, and if you've accomplished the training, then you may be able to qualify to be a peer leader,
Peer educator.
peer educator, and that's an opportunity to receive some
Payments.
financial and payments. The training sounds exciting with lots of food. There's financial supports, food,
Babysitting.
but those are just the treats that go
Right.
in with the real important information of what do we learn from all of this?
One more thing also, we are multilingual, so we can help also with that. If it's any need that, oh, I cannot understand, so we have people who can help with that.
That's wonderful.
Translated.
Spanish, Haitian Creole, and Arabic and English right this minute. And we have access to other LIPS.
Lip services, the language
yeah.
language program from the teens over at the
Welcome
Welcome
Project, yes.
So
we've used them a lot.
that's wonderful. Well, Suzanne and Jenny from Wayside, thank you
you.
very much for sharing with us all of the programming that you have for HIV prevention and rapid testing, education, peer education programming. We learned a lot today, and there's a lot more to learn by calling Wayside and finding out a lot more. So thank you for joining us. Thank you to our communications team. We have Joe Constantine, George Wood, and Steve DiCarlo, always as the best team ever. And if you have any questions on commissions or any of the programs for the Health and Human Services program, give us a call. You can always call us at 311. Thank you for joining us.